We want to welcome those of you who are joining us on Facebook Live again today and say thank you to all of you who have tuned in and joined us in the conversation about what's going on with coronavirus here in Arizona. I'm Katie Rammel. Alongside me here, Garrett Archer, our data guru who goes through all the numbers all the time and helps us find the information that you're looking for so that you can make the best choice to keep your family safe. It is already Thursday, Garrett. It's already
Yes, it's Thursday.
Thursday. And a bit of an interesting week, how it started. We had a delay in some of the reporting numbers coming from Sonora Quest. So we had been watching those case numbers very closely. And then as we round out the week, we've had such a high test count that some people are getting really delayed results. For a while there, we're seeing people get answers rather quickly. They might test on a Saturday, maybe even get their answers back by Tuesday. But I know folks that tested this last Saturday and are still waiting for their results, and just sheer volume coming in of people getting tested right now. What did you see in the numbers that came out today? And if you want to look along with us, they're on Garrett's Twitter page. I've also retweeted them, and we'll put our Twitter account up there on the bottom so that you can follow along. But what numbers did you see that came out today?
So going through the summary data that was supplied by the AZDHS, supplied every morning, we had 3,333 positive cases today and 37 additional deaths. That brings the totals for the state to 87,425 cases and 1,757 deaths today. As far as diagnostic tests, they reported about 11,200. They reported 11,235 tests, and then for the antibody tests, the serology tests, it was about 2,276.
So the difference for folks who are following along, the PCR tests are the nasal swab test, or also referred to as the diagnostic test. And the antibody test is to see if you ever had the infection at a past date, that you'd have antibodies in yourself right now that could be markers to show that you might have had this in the past. So two different numbers that we have coming in to the state here. What other numbers did you see today there, Garrett?
Going to the hospital specific the total census numbers for the state. We have in the intensive care unit, we have 89% of the ICU beds across the state are occupied. That's a slight decrease from yesterday. It was 89% yesterday as well, but as you can see, 1,495 beds yesterday, 1,483 beds today. So there's a slight decrease in the ICU beds. Inpatient, which is the general acute beds, this is 86% today. It was 6,532 yesterday and 6,602 today. So we're seeing, but as you can see, based on the hospital census, it's been fairly steady at about 85, 86% since June 23rd. And then going over to the hospital specific, the COVID-19 specific metrics, we see, again, record highs for inpatient acute care COVID-19 patients, almost 3,000 patients there. Currently, this is real-time data, near real-time data. For the ICUs, we have another record of 723 patients. We did have a record discharge, as you can see, 422. That's much larger than any discharge number we've had as of yet. And then we also had unfortunately, what I thought was going to be a trend has been broken. And now we've got another record emergency room department numbers for COVID-19 as well.
Garrett, some of the numbers that were coming in that we were looking at closely is the percent of positive tests. And I know that to sort of smooth out the numbers and get a general idea of the trends, we look at week to week. Is it too early to see what's happening overall in the past 4 to 5 days here to gauge it against some of the previous weeks?
To get a true idea of the percent positive, it is still a little early. As you can see, the June 28th right here, this is only a test collection number of 7,450. That's far too early to determine what this true percent positive is going to look like. Right now it's at 23%, but that's with a very low volume of tests. So we're going to be watching this in the next couple days, or 3 or 4 days, as this starts to really fill in. Today's tests came back at about 30% positive. Now that's the daily reporting. So that I need to always preface that with the fact that because this is daily reporting, a lot of these tests and cases are filled in over a period of 7 days. So while we look at that number and we say, oh, 30% today, it does not at all mean that 30% of tests yesterday came back as positive. It means that of the numbers that were reported yesterday, 30% of them came back positive. And when you sort of mix those together where they should be, the percent of positive is a little lower than that.
Yeah, it's definitely something that you can keep an eye on, but scrolling down here to the bottom of this chart and seeing the progression over time gives you a better idea of how those kind of look. Luis asked a few minutes ago, she asked, is it even possible to test 3,000 people a day? In fact, it is possible. We've seen usually about 15,000 tests a day, Garrett, coming back at this point.
So yes, these are the actual tests a day. Let me put this on diagnostic tests right here, just for anybody who's starting with us. PCR, as you said, is the diagnostic nasal swab test, and the serology is the antibodies. I'm going to focus on the PCRs as those tell us who is currently infected. But you can see our high right now is at about 18,000 tests collected on June 23rd. So that is right now our sort of peak day, or the peak amount of processing that the labs can do. Now I do have the daily charts that show that they're able to on any given day report about 15,000. So there's, as you can tell, it sort of is creating a bit of a situation where the backlog is getting a little longer, a little bigger, because they're reporting to us 15,000 here, 15,000 there, and then they're filling into 18,000 on 7 days prior. So there's a little bit of a backlog, but it will show up.
Yeah, we're seeing that a little bit, as we were mentioning earlier, some of the people receiving their results just a touch later than normal. We are seeing long lines around the valley as well. Over at South Mountain Community College right now, there is a testing area set up there, but man, we have seen long lines today, in some cases up to 6 blocks. If you are on here and you're looking for testing, you can go get in line down there. Go with a full tank of gas, because the lines are long, and obviously it's hot out there. They'll be out there until 6 o'clock tonight, or until they run out of tests. And there's such high demand out there. Just make sure to bring your ID. That's what they're looking for when you head out there. So make sure that you have that with you when you head over there. Once again, that's out at South Mountain Community College. The number of deaths that we were reporting today, Garrett, what number came in from the state?
The state reported 37 deaths today. So, and just to kind of go through this one more time, this does not mean that 37 people died overnight. This is a number that is sort of filled in from about, it's anywhere from 7 to 14 days. Deaths take a little longer to fill in, so they will occur. You'll notice if you watch sort of the actual date of occurrence for the deaths, they will fill in later. So, or excuse me, earlier. So we'll have deaths filling in from mid-June, early June, even today, and that's still not entirely atypical for that to happen.
Yeah, it's one of the reasons watching the rate of death too soon after a peak in hospitalizations won't give you the true number, unfortunately, of what we'll end up with. That percentage will likely trend higher. So we're seeing about 5% across the US, 5% across the globe, according to Johns Hopkins. And here in Arizona, it's still at about 2.3%. Obviously, we hope it could stay that low, but if you're looking at some of the other trends across the country and across the world, there's no reason to believe that simply being inside Arizona's, the state of Arizona borders would somehow protect you, or those numbers end up any differently.
Yeah, so I've got the chart pulled up here. This is the epi curve chart for the deaths. As you can see, this light blue color are deaths that were added yesterday, and in this morning's report they were added. And as you can see, the most recent, July 1st, July 30th, although there is a spike for June 30th, they're very low. You see, there's a major drop off, but then they're pretty high up here in about 14 days or so. So these take about 14 days before they settle, and we start seeing what the true numbers are. So again, it's I put this yellow line here to sort of show a trend, and it will self-correct over time. But right now, at this very moment, there's a downward trend from the 10-day mark. But that, again, we don't know what's going to happen over the next 3 or 4 days. That may stay on a downward trend. We are going into the weekend, so we could be hitting another peak for the weekend. And then that might go back up again. We don't know yet. So it's just too early to tell.
Garrett, can we see this chart anywhere? Where can people find this particular chart?
This particular chart, I do publish this not on a regular basis. I publish this probably once every other day, just to sort of give it time to fill in. But I will publish this on Twitter, and I'm working with our IT team to find the best place for this to be published on our website. We have a couple of technical issues with some of these, so I'm working with them.
All right, sounds good. So we can get a closer look. A few minutes ago, Debbie asked, is Doug Ducey going to be speaking today? At this point, we have not heard anything about any plans for him to be speaking. Oftentimes, if he does make an announcement, it is on a Wednesday, but then again, or a Thursday, Wednesday, late in the week. But again, this week was an anomaly when he spoke on Monday and then made those sweeping changes to the start of the school year, pushing the in-person school year back to August 17th. So now most kids are still starting on time, but it's up to the parents at home. I got a call from the school today, and they said, do you have devices for the kids to use? Do you have Wi-Fi? Schools making sure that our kids are going to be ready to be starting to do work right away at the beginning of August, but then no option to meet in person throughout the state, at least until August 17th. And then the other sweeping changes to the bars, to the gyms, to water parks, all of those changes came on a Monday as well, Debbie. So we, of course, will keep you posted if we hear anything coming from Doug Ducey. Again, he was meeting with Vice President Pence yesterday. He requested 500 more personnel to come and help, personnel of doctors and nurses to help here on our front lines and protect Arizonans. And Mike Pence agreed to that, and those people are being sent here to Arizona. I want to address one of the questions that you're so welcome, Debbie. Thank you for saying thanks. We just want to keep you guys up to date. So, Debbie, we appreciate the question. One of the other questions we got over the last couple of days was about the casinos. So I want to update you on that. 3 casinos have opened up. They took 2 weeks off. A lot of them were taking a deep clean, but they are 3 of them opening back up today. I see Stephen asking about that right now. They were open, they shut down, and now opening back up again. So we'll see. They say that they're taking more precautions to keep things cleaner and keep things safer, but that's where things stand so far. So day 1 of reopening, we'll see.
And those are the Gila River casinos.
What was that?
The Gila River casinos.
Gila River, that's right. Yeah, so they're back open. About the liquor licenses, let's see. Kathy was asking about that. They revoked 2 of Lifetime's liquor license. She's absolutely correct. Over at the Biltmore and at Scottsdale, we're also hearing more about a liquor license violations at Varsity Tavern as well. That just came down not too long ago, a matter of minutes before we jumped on here. So the Department of Liquor Licenses and Control issued a notice of violation to Varsity Tavern. So they recently became the subject of an investigation for some violations of the Arizona state liquor law specific to the requirements to protect customers and having violations out there. So we'll be tracking that throughout the evening newscast as well. So that was the very latest information just coming in. Paris, oh, thank you for saying so. Yeah, we're trying to get to most of the questions on here so that people can find the answers they need. I know it's a lot of information that comes in, and if we don't get to one of your questions, be sure to jump on abc15.com/coronavirus, and then you'll find a whole section dedicated to all the latest news that's coming out. Of course, Garrett, we're approaching a holiday weekend, so that's one of the big concerns is if people will continue to social distance or social distance at all over this holiday weekend. So if you're interested in what areas have shut down their 4th of July celebrations or are altering plans, you can also find that on our website, all the very latest details. We've been reaching out to everybody who's having any sort of event to get the latest information for you on how those things are changing. So
yeah, we actually we talked about this yesterday. Since we're coming up on a holiday weekend, I'll bring this back up. I'm sharing my screen screen here on a graph that was prepared by OH Predictive Insights using the Google mobility data. And just drawing your attention to sort of this number right here. This is Memorial Day weekend, and you can see that the Parks Index sort of skyrockets on Memorial Day weekend. And this is sort of something that the health department is looking at and trying to make sure that this doesn't happen again, and you don't see this massive spike in social mobility on one given day. So they want to keep this number. As you can see, over time, it's been fairly flat. It's moved up and down. It hasn't been entirely increasing by sort of these large numbers, but they don't want these sort of spikes to happen right now. So this is why they're taking actions in the Tonto National Forest and other places to keep this sort of spike from happening.
And Garrett, where can folks find this? This is a fascinating look at how things have changed over time, and I love how they point out all the different measures Arizona's taken, and we can really see what has worked for us and what is not working. Where can folks on here find that?
So this graph, this was a blog post by, you can see the URL right there, ohpredictive.com, and it's a blog post on there, and then it's also on their Twitter site, OH Predictive. So those are sort of the two places you can go to find this particular graph. I really liked this graph, so that's why I wanted to highlight it.
Yeah, it's. Do you know how often they're updating it?
This is the first time they did this graph. I know that the Google mobility data only updates every other week or so. So they're only going to update. Anyone who works with this data can only update it every 7 to 10 days or so for it to be useful.
Nancy has a question for us. How many have recovered from COVID-19? Nancy, we want to be sure to address this. We get this every day when we jump on here. There is no agreed upon definition of recoveries. So what might feel like a recovery to me might not to you. So there is not a standard definition, if you will, just yet. We are looking at the closest number we have, which is being released from the hospital, a discharge from the hospital. Nancy, if you want to look that up at any time, and we'll show you what the number looks like right now, go to covidtracing.com. Is that right, Garrett? Covidtracing.com?
COVID tracking.
COVID tracking.
Yes, but you can also
all run it together by the end of the week. COVIDtracking.com, and our producer has put that up there for us right there on the screen. Carrie, thank you for adding that so that she can jot that down. Save it on your browser, then you're able to peek at it. You do have to go to a pull-down menu and ask for the state you're interested in tracking. I'm assuming you're in Arizona. You can pull that down. It's likely right around 10,000. I didn't check it this morning.
Yesterday. 10,000. Yes.
Is it 10,000?
Yes.
Yeah. Yesterday it was around 9,000, so I think it was like 9,400. So that's the best place to get information. But again, you're so welcome, Nancy. You're welcome. I hope that helps. That's the place that you can look to find the closest thing we have for it. So
yeah, and then of course there is issues with the discharge. That's why we don't publish it as a recovery either, because a discharge could mean multiple things. Someone can go back into the hospital from a discharge. We don't know if it means transfer from one's hospital to another. We don't even know if it means someone died in a hospital bed and it's put out as a discharge. So without those, and the system that they're using to report these things is not designed for COVID-19. So there's a possibility that a lot of those sort of, a discharge just means a bed is now free. So that's one of the reasons why we're not skeptical of the discharge number, but we certainly have to just, every time we point it out, want to make some caveat to it that while it is a good estimate, a proxy of what's happening, it's not a true recovery number by any means.
Yeah, and we also don't know, Garrett, unless you've heard differently. We don't know if they duplicate that number as well. I had a friend who has COVID, and was in the hospital 3 different times. So
they will not deduplicate that number.
Yeah, so she was discharged 3 times from the hospital. She would count into that number 3 times.
Yes, this number, once this number is reported for the evening, it stays that way. It does not deduplicate because that is their daily census. So if somebody, as you say, was discharged from the hospital and comes back, they would then be counted not only as a discharge, but then an additional inpatient 3 times over the course of time.
Right. So hopefully that answers her question. That's the closest we can get for you. But we get that question every day, but we do want to address it so that we can help you sort of find those numbers on your own as well, if you don't necessarily get that number on a daily basis. Garrett, is that sort of the same with ICU beds? I think you said ICU beds were the only thing that went down. Do we then know if those are if ICU beds go down, we don't necessarily know if that's a recovery or a death, do we at this point?
No, again, these are census numbers. So
Yeah.
if somebody dies in the ICU and a bed is freed up, then it counts as the number of ICU beds going, the number of available ICU beds increasing. So what we're seeing is we are seeing a record number of COVID-19 patients taking up ICU beds, but a lower number of total ICU bed occupation.
Mhm.
And that could also have to do a lot with I know a lot of the hospitals are starting to put out plans to sort of delay some of the elective surgeries that are less crucial so that they can maintain a level of ICU that's not sort of in that crisis care standards. I know that they have a crisis care standard plan now, but of course most hospitals are going to do everything they can and not actually start to implement it.
Yeah, that's a very scary situation. I've heard from people who say, you're figured into a chart, a color-coded chart, and people have said, if I'm 65 and I've stayed home and I'm socially distancing and I'm wearing a mask and I'm doing all the things to be safe, and then say a 25-year-old who's not done any of those things, and then they would look on a chart better than the person who followed the rules, then how fair is that? Is what some people are arguing. Yeah, that it's a valid point from those people. I want to address one of the comments. Jess writes in, "Hi, Katie." Hi, Jess. Thank you for your question. She writes, "I'm an Arizona teacher. Any projections on in-person school continuing to be pushed back?" Yeah, they closed in March. The numbers were very low at that point. Now they're very high. The teachers and families are very stressed about what the future holds. As a parent of 3, I share your concern, Jess. I think of everybody who's trying to teach at home and help their kids learn, and then we're going to our full-time jobs as well and trying to juggle it all. We haven't heard anything about any projections of school continuing to be pushed back, but as we heard in the governor's conference, he did say we would have to meet certain metrics for this to happen. So he stressed several times that August 17th was an aspirational goal in all of this. So we're hoping we can get back into the classrooms by August 17th, but that it's not promised at this time. Jess, I'm going to point you to the best resource we have at ABC 15, and that's Danielle Lerner. She is on the education beat all the time. She's checking with school districts and all of you teachers and parents every single day. It is 100% of her focus at ABC 15, and you can follow her on Twitter, the best up-to-the-minute information. And then there's a whole education section on our Facebook or on our abc15.com. That's got all the details on there, and she's tracking everything. So she's going to be checking in with all the school districts and keeping us updated. We know that it is such an important topic. It's important to me. I know it's important to all the other parents out there. You cannot get back to work full time with full focus unless these kids are back in school. So it's one of the topics everybody's interested in. So Jess, I just want you to know we'll stay on it, and thanks for joining us on here, and thank you for the question. Of course, we'll keep you updated. Garrett, what else were you seeing today? I saw almost all of the numbers were up for hospital-related numbers except ICU. Is that correct? Was that the only one that we were able to see heading down a bit?
Yes, that's. I'm trying to go back to those numbers. As you can imagine, I look at numbers all day, so yeah. Things. I have to sort of go back to reference what I looked at before. So yeah, let me just bring that up really quick to show. I do a daily tweet that talks about this every single time. So this is what sort of everything looks like if you just want to see it in a nice short little form here. You've got the acute care beds up, a tiny bit, ICU up, emergency ventilator. So all of the actual hospital assets, ICU went down, but everything else went up. There were records in emergency and ventilators. And then here's what we just went over, the COVID-19 numbers. And you can see that with those are the inpatient, ventilator use was up, ICU was up, discharge up, emergency up, and then intubations, which is the when you actually execute the use of a ventilator, that's down as well.
Mm-hmm. Julia writes in, 3 of my dad's cousins have COVID-19. They are in extremely critical condition. And Julia, I just want to take a minute to recognize your family and the comment that you've left there. I'm so sorry that they're going through this. I know a lot of families that we've highlighted over this time have had multiple members sick, multiple members that don't have someone there by their side except for the healthcare workers. So this is why we're doing this, Julia, is to keep people informed and help them find their own information on this so that they can work to keep their families safe as well. But I wanted to pause and say, we're definitely thinking of you and your family. I don't know a family out there at this point that hasn't been touched in some way by this. So we'll keep thinking of you, Julia. Thanks for joining us on here. All right. Any other questions we want to get to today? I know we're already, it goes by so quick, Garrett. We just dive right into the numbers and get right into it with everybody. But I'm quickly scanning through some of the comments just to see if there were any other questions we could help you find, any other data that we've been tracking throughout the evening. Will the percentage of ICU beds go down as they try? Well, the percentage overall as we try to add some beds. So basically, if we go into surge mode or we add another hospital, how is that going to change things?
So I've asked the AZDHS this question. It's still sort of unclear as if they're going to add the surge capacity to the licensed beds that's on the worksheet now, or if they're going to just have an additional dashboard specifically for surge capacity. So I'm not really sure what they're going to do yet, but what I can tell you is that the ICU and the acute care beds have not been, the surge numbers have not been added into the equation yet. So when you see 89%, when you 89% ICU usage, that's actually, if you consider what they can do for ICU beds, that's about really 67% at this point when you factor in the ICU surge capacity. So, and those numbers aren't there yet. So we're still seeing 89%, but please know that there's 640 sort of the ability to increase the ICU numbers by 640 that has not happened yet.
Dorothy Rogers is asking, and Dorothy, thank you for your question. And Carrie, thanks for your comment too. I see that there. You're so welcome. That's what we want to do, is keep you all updated on here. Dorothy is asking, when will the 500 medical personnel get here? I have not yet heard a date. Obviously, it was just requested yesterday. It was just granted yesterday. So I'm sure as soon as they can. That was one of the concerns about St. Luke's. And the question right before Dorothy's, Lee writes, what about St. Luke's? And Lee, one of the things we saw, the reason your question goes right along with Dorothy's is because there are beds, but there weren't necessarily the people to staff the beds. So that's one of the things that we wanted to make sure that there were enough people, and we'd been pressing the governor and pressing them during the briefings to find out, do we have the kind of physical care people there to help if we have the beds? Because that's how they were counted, Garrett, just by beds, but we didn't have numbers for staffing. Yeah, it was one of the concerns. So many more questions.
I lost you for a second.
Oh, that's okay. So many more questions coming in. I want to get to each one of them. One just went by. Is an individual who is tested multiple times counted once, or each time they test positive? Caroline, this is a question that we get often, and I want to make sure we answer it. They've worked to duplicate the positive test. So when you test positive, you are matched up. So if you're going to go take another test and you're still trying to work for that negative test and not getting there yet, so you've taken a couple tests and they're positive, you're only counted once. It is only counted one time. It's one of the questions that we pushed for the answers when we got it a couple of weeks ago, and that really helped solidify the numbers, if you will. Garrett, any other things you want to highlight before we wrap things up for the day?
So the only thing I would say today is we talked about yesterday is the watching the trend line of the cases versus the test and what may occur. So we had really interesting. We had some really wild swings this week. So and today was sort of what I'm expecting to see right now is about 3,000, anywhere from the range of 3,000 to 3,500 cases. So this is where, this day sort of affirms that we do have a possibility of a plateau of cases. We're going to watch the next 2 days to see if that plateau of cases is maintained or if they start to increase their testing numbers. But this is sort of the, now we're starting to kind of go back into a sense of normalcy as far as where the numbers are headed. So tomorrow, if we're either going to, if we have a wild swing, then there's still a lot of backlog from this week's wild testing issues.
A wild swing high, you're saying?
Yeah. But if we're back still in the 3,000, if we're in this sort of range right here, then then we can start to determine what our testing capacity is in the state.
Yeah, so possibly a plateau or just possibly an anomaly from those tests that were delayed at the beginning of the week.
This is sort of the first day that was the quote unquote normal reporting day for this week. So wasn't a record. It was sort of with the percent of positive we've been hitting with the number of tests that came in. It's about where we were expecting to see it right now. Still too high, of course. We want to see a much lower percent of positive, but it's at least where we were expecting to see it. It was within that range.
Yeah. I just want to remind people again, if you are looking to get tested, there is a testing site that's going on right now. It's over at South Mountain Community College. I do have to warn you, there are some long lines out there, several blocks of lines. So please gas up and stay hydrated as you're headed over there, because it could be a very long wait. You do need to bring your ID. It is going on until 6 tonight or until they run out of tests. So that is the place to go at this point, at this hour. That's kind of where the spot is for testing around the valley. You can also check with Honor Health and some of your other, obviously your healthcare provider. Give them a call and they can direct you where to go as well. All right, so many more questions coming in. Can you guys make it clear this isn't a second surge? Yeah, that's what they're saying. This is not the second surge. Stephen, you're absolutely right. This is the continuation of the first COVID situation that we're in. This is a long stretch, Garrett.
Yes, no, this is not a second wave. We're fine with this. Our increase in cases that we've seen corresponded with an increase in testing. So when we were during the shutdown period, and we had these very low numbers, we also had very low test numbers. So as we increased our test numbers, our case numbers were increased as well. Now, there have been sort of shifts to where the hot spots have been during this surge. They were not all equal. In the beginning, Arizona, the northern portion of Arizona, the Navajo Nation was hit very hard. And then it shifted to the southern border counties, Yuma County, Santa Cruz, and Cochise to an extent. And now it's sort of shifting back to Maricopa County. And it's sort of more even out a little bit more, with the exception of the northern counties. The tribal counties are taking much more stringent precautions than the rest of Arizona. So while the distribution of cases is starting to show up more like it's community spread across the state in many ways, it's not hit. The northern counties, because of their precautions, are seeing a little bit less.
Mm-hmm. Garrett, can we peek at the age groups? There's been a couple questions on how things are shaking out based on age, and that's always of interest to people here.
Sure.
When you dive into I want to teach everybody where to find this stuff too, so they can find it on their own. When you dive into the Arizona Health Department of Health website, you're going to find a whole wealth of information. So if you are looking for ages and demographics like that, in some cases, I think Maricopa County also has, if there's any other underlying illnesses going on, you can dive right into those numbers and see for yourself more specifics that apply to you. Maybe you're interested in a particular zip code or an age range or an ethnicity. All of that's right there on that page. So Garrett, show us what that says.
So this is what this is the age groups, the cases, the positive cases by age groups. And you can see right here, about 9,700 less than 20, about 44,000, the largest portion of the cases, 20 to 44, 13,000 for the 45, 54, 10,000 for the 55, 64, and 10,000, about 10,000 for the 65 years and older. I watch this on a daily basis to see how it's growing. The spread in these age groups was, for the past several weeks, dominated by the 20 to 44 age group. As you can see, they grew by a lot faster proportionally than the other age groups. That is starting to slow down. So we are now starting to see a more even percentage of growth in all of the age groups, which to an extent is a little bit more concerning, because now we're starting to see higher transmission to the 65 and up category than was previous, as far as the portion of growth. So that's something to watch. That's not a great thing, but it's something to watch to see if that changes. Right now, I've got about 4% across the board growth, a little bit less in the 65 and older category, but it's still a little bit more evenly distributed, which we don't want to see. We sort of wanted to see the older populations not with a lower transmission number.
Yeah, it's absolutely so dangerous in our older population. So that's obviously one of the big concerns. Garrett, is there anywhere that accounts for, so we have these age ranges here listed on the screen. Is there anywhere that sort of overlays that into a per capita situation based on those age groups? So like, let's say we have a higher population of 65 and older. Is there somewhere that we can see those numbers together?
No, but I will have something ready for you as soon as possible.
Oh, that's
I
great.
can't do that now. It's going to take me at least a day to have that ready, but I'll have something ready to reflect that.
We always appreciate that. It just gives us a better idea of how things sort of look out there. Okay, also on this page, there's race and ethnicity, and there are changes in that this week too.
There have been changes. We're starting to see there was a corresponding, of course, with the sort of increase that we had in the southern border counties. We started to see a faster increase of the Hispanic or Latino demographic right here, and we're starting to see this again even out. Although the Hispanic or Latino is the majority of known cases, you have to also understand that there's 48% of these cases are unknown. So that's 42,000 of these cases there was no ethnicity for, at least recorded. So but of this sort of sizable sample we have, we can see that the majority of them were Hispanic. But the growth is now sort of the clip is the same now. They're moving at the same speed. Now, of course, always have to point out the Native Americans. While it's not growing as much as it was, this is a much higher proportion of, if you look at a per capita numbers in Arizona, that's a much higher proportion of the Native American population than either of the other two numbers.
As we all know, an area hit so hard, and they've tried to take aggressive measures to try to get things under control at this point. Because there's such a huge section of unknown there at 48%, is that a number that you don't watch as closely because it has such a huge section of unknown, or is it still giving you some worthwhile data?
No, I think that the data is worthwhile because just based on what the distribution in the counties and where we're seeing cases in the counties, that number at least it makes that distribution sample seems to be at least around where it should be. So basically what that means is these 48% unaccounted for cases likely look very much like what we have for accounted cases. It's probably not the case where this is flipped in this 48% and it's 24-16. It probably matches this, or at least is close.
The other thing on that page is, of course, the high risk categories and the other chronic diseases. Let us know how those numbers are looking today.
So yeah, this is as you can see on the high risk, or let's start with chronic medical condition. This shows that 70,000 cases do not have a chronic medical condition. And then 20%, 16,000 do. And then what they do is they take a high risk category, which is it's 65 plus years or at least one chronic medical condition. And they sort of factor what that looks like, but that number increases now about a third, a little lower than a third of the cases in the state are someone that is either 65 plus or at least has a chronic medical condition. And then here's the balance of that, about 64,000 cases that are, not in the high risk category.
Right. Fascinating stuff, Garrett. Anything else you want to touch on before we sort of wrap things up for the day? I do want to let people know there are some changes to restrictions in California. And of course, we're coming up on a big holiday weekend. So if any of you are planning to travel out there and you should take a look at what those changes are so that you can plan around and plan for food. If you're staying at a hotel or maybe like an Airbnb that you have the ability to have everything you need while you're out there and enjoy the vacation as you expect it to be. All of those are over on my Facebook page. So on facebook.com/news from Katie, you're going to find a couple posts back. You'll find the updated information from California so that you can plan appropriately. Anything else you want to touch on, Garrett?
I would just remind people that this information is all publicly available at azdhs.gov. And then, as we pointed out as well, if you want to see these daily reported numbers over time in graph format as well, you can either go on my Twitter, I have that, as well as the covidtracking.com will also have all of this data sort of in a digestible format that you can actually download and play with yourself.
Yeah, you can get a look at where we've been and hopefully get a better idea of how things are going to be. Thanks to all of you who popped on here, and hopefully we got your information to you in a very easy to digest way so that you can be able to look up these numbers for yourself and make the very best choices, the safest choices for you and your family. So we appreciate all of you taking time for us today. Oh, thanks for saying thank you, Dorothy. Excellent information as always. Thank you again. Well, Dorothy, you are welcome. This is why we do it, just to help you guys find this stuff. It's not always easy when you're just looking at a brand new website, and we've been looking at this stuff every day since January. So we just want to help you find all of that information even easier. So Garrett, thanks for taking time, and thanks everybody for tuning in. We'll be back tomorrow, same time, same place.